1. A new study found that people who exercise more than the current U.S. physical activity guidelines may live longer. 2. The current guidelines recommend 150 to 300 minutes per week of moderate intensity activity, or 75 to 150 minutes per week of vigorous intensity activity. 3. The study participants who exercised 2 to 4 times more than the recommended minimum had a 31% reduced risk of early death. The current U.S. physical activity guidelines recommend 150 to 300 minutes per week of moderate intensity activities, or 75 to 150 minutes per week of vigorous activities, for substantial health benefits. Adults who followed the minimum recommendations reduced their risk of early death by 21%, according to a new study published by the American Heart Association. But those who exercised 2 to 4 times above the minimum cut their risk of mortality by as much as 31%. These findings are consistent with what researchers typically know about exercise, said Beth Lewis, Ph.D., a professor in sport and exercise psychology at the University of Minnesota, who's not affiliated with the study. Lewis explained that the first 150 minutes of moderate intensity activity, or 75 minutes of vigorous intensity activity, gives people the most health benefits. There are added benefits if people exercise longer, but not a lot, she said. Setting an expectation on exercise duration could discourage people who have busy schedules, said Nicole Keith, Ph.D., a professor of kinesiology at Indiana University. Getting 30 minutes of moderate to vigorous physical activity most days of the week can already improve health outcomes for adults, Keith added, and it's attainable for most people.